Hello, my name is Seema Hassan, Healthcare Data Analytics Specialist. I've developed 8 flagship projects addressing critical challenges in healthcare integrity, fraud prevention, and patient safety. Today, I present a national-scale opioid prescribing oversight system that protects billions in Medicare resources while combating the overdose crisis affecting millions of Americans. I developed a national opioid prescribing integrity solution combining machine learning with peer benchmarking. This system protects 69 million Medicare beneficiaries and $216 billion in annual prescription spending. My hybrid analytical framework transforms how America detects inappropriate opioid prescribing and prevents overdose deaths. Inappropriate opioid prescribing costs Medicare $1.22 billion annually and fuels a crisis claiming over 107,000 American lives. I identified 51,660 anomalous prescribers from 1.38 million providers nationwide. The framework achieves 61.6% concordance between independent methods, preventing 28.1 million excess prescriptions annually with a pathway to $2.57 billion in national savings. America faces dual crises: $78.5 billion in annual opioid misuse costs and 107,000 overdose deaths. Medicare covers 69.3 million beneficiaries with 5-fold geographic prescribing variation. Current gaps: only 0.1% of prescribers reviewed annually, 196 specialties lack peer standards, no systematic financial measurement, and $12,000 per manual investigation makes national oversight impossible. I combined isolation forest machine learning with statistical peer benchmarking, validated through 100 bootstrap iterations. My risk scoring weighs: peer deviation 30%, total claims 24%, prescribing rate 18%, intensity ratio 14%, and cost metrics 14%. External validation confirmed 28 OIG matches, 63% 2-year stability, and CDC mortality correlations, ensuring accuracy and regulatory defensibility. 5.0% of Medicare prescribers, 51,660 providers, exhibit anomalous patterns. Top decile prescribers average 269 monthly opioid claims versus 0 for peers, generating costs 23 times higher per beneficiary. Distribution: 99.6% low risk, 0.35% medium risk, 0.01% high risk. This precision enables targeted enforcement while protecting legitimate practitioners. 95.0% detection rate across 51,660 prescribers. 61.6% concordance between methods. 63% 2-year persistence with 0.71 correlation. Bootstrap validation: 2.3% standard error. External validation: 28 OIG matches. Coverage: all 61 jurisdictions. Critically, the system excluded 7,701 oncology, palliative, and hospice specialists, preventing inappropriate flagging of legitimate high-prescribing providers. 4 scenarios with escalating returns. Conservative: top 100 prescribers, $46.4 million savings, 12-to-1 ROI. Moderate: 2,500 providers, $584 million, 28-to-1 ROI. Comprehensive: all 51,660 anomalies, $1.22 billion, 45-to-1 ROI. National scale: $2.57 billion, 62-to-1 ROI. 10-year impact: $9.8 billion savings funding 1.96 million beneficiaries, 450 health centers, and 65,000 treatment beds. 3 federally mandated sources ensure credibility. Medicare Part D prescribers file: 1.38 million providers, $180 billion spending. OIG exclusion list: 81,914 providers for validation. Medicare geographic data: 115,396 drug location combinations. All datasets undergo rigorous federal quality assurance, the same sources used by CMS, OIG, and GAO for national oversight. 6 major federal initiatives supported. Support Act 2018. Fulfills Section 6052 monitoring mandate. MACRA. Operationalizes specialty benchmarks. 21st Century Cures Act. Implements FHIR, HL7 APIs. Payment Integrity Act. Reduces $1.22 billion improper payments. Executive Order 13985. Ensures equitable enforcement. HHS 5-point strategy. Funds evidence and treatment access. Phase 1. Years 1 and 2. Target 100 to 2,500 prescribers. Deploy real-time dashboards. Establish 196 provider benchmarks. Generate 46 to 584 million savings. Prevent 5 to 10 million inappropriate prescriptions. Phase 2. Years 3 to 5. Expand to 30 states. Integrate Medicaid. Deploy fraud ring detection. Generate 2 to 6 billion savings. Prevent 20 to 30 million prescriptions. Extend Medicare Trust Fund 6 to 9 months. Year 5 plus. Full national deployment. Deploy adaptive ML with continuous retraining. Establish National Risk Registry. Integrate CMSOIG GAO DOJ systems. Obtain FDA validation. Generate 9 to 11 billion annual savings. Prevent 40 million prescriptions. Extend Trust Fund 1 to 2 years. Transform from reactive investigation to proactive prevention, establishing national standards for all controlled substances. 4 risks addressed. Data delays. Phased pilots with public data. Regulatory approvals. Staged FDA validation. Infrastructure scaling. Cloud-native elastic architecture. Provider pushback. Transparent dashboards. Education. Appeals. 5 key partnerships. CMS, HHSOIG, DOJ, State Medicaid, Commercial Payers. Success metrics. 70% acceptance, under 10% false positives, under 30-day intervention, 80% cost reduction. 100% schema validation pass rate, 2020 valid peer cohorts. 98.7% subsample stability. Full reproducibility. Open source Python, fixed random seeds, version controlled parameters. Bootstrap validation. 2.3% error across 100 iterations. 61.6% ML statistical agreement. OIG and CDC external validation. Processing 1.38 million records with zero data loss, 100% accountability. $1.22 billion annual Medicare savings scaling to 9 to 11 billion nationally. ROI. 12 to 1 to 62 to 1. Prevents 28.1 million risky prescriptions annually. First comprehensive, scalable solution for Medicare-wide opioid oversight. Novel hybrid methodology. 7 federal policy alignments. Production-ready deployment. Extensible to all payers and substances. Flagship-level American healthcare innovation. $1.22 billion annual savings preventing millions of deadly prescriptions. 51,660 anomalous prescribers identified from 1.38 million providers. 61.6% method concordance. 95% confidence intervals. Reproducible, scalable, deployment ready. Path forward. Immediate CMS pilots, near-term cross-payer expansion, long-term national compliance utility. Protecting healthcare integrity, saving American lives, securing our fiscal future.